Lumbar disc bulges are quite common, but in majority of cases, this type of injury should be managed with conservative treatment. Some of you guys watching this video been suggested to do surgery for your lumbar disc bulges, and you may wonder, should you go for a surgery or not? In this video, I'm going to talk with my online clients, Ayushi, who've done a lumbar decompression 2.5 years ago, and in this video, she shares with you what was her complication post-surgery and how she ended up contacting me after 2.5 years of pain and where is she right now in her recovery. If you've never been to this channel, my name is Bob. I'm a physical therapist. I help people globally all around the world through a conservative treatment and help them to first identify and understand what is their injury. Second, help them with a day-to-day basis plan to get them out of the pain. And third, get them back to full capacity. If you're interested to get more information, you can always contact me through my website or book an online consultation with the link below and we can get you started right away. If you find this video helpful, make sure to subscribe my channel for my weekly update and don't forget to press that like button. Let's get started. I suppose, Ayushi, you've been working with me for quite a while now. It's more than 5 months now, right? I suppose today we wanted to go through your story and share your, I suppose, recovery story with people who are watching this video. And maybe you start with telling them what was your initial injury, how did you end up contacting me, and we go from there.
Okay. So the initial injury I had was in 2019. I don't know how that happened, but I suddenly felt some pain, like it was a shooting pain in my left leg. And I saw a couple of doctors. Everybody told do some physiotherapy, try out physiotherapy, or else if it doesn't work out, surgery might be the next resort for you. And back then, like I didn't had too much knowledge also. So I mean, I tried for at least 6 7 months, nothing. Like, there was no improvement. So we went for a surgery.
And what was
And
the injury? Ayushi, did they explain it to you? What was the injury? Did you got the MRI?
I got an MRI. They did tell me like it's a disc bulge, like L4, L5, L5S1 level. The disc bulge was there, but the compression was only at the L4, L5 level, not the L5S1 level. So, uh, I got it operated. It was a microdiscectomy, I guess that they did at that point of time, and they operated at the L4, L5 level only because that's where the compression happened for the nerves. And I was fine by then, like once the surgery was done, but later on, slowly, like after a month's time, uh, I got an infection developed within my spine. Like it was a discitis, if people would understand.
Gotcha.
It was discitis. It was termed as discitis, honestly, but during the time, like my treatment went on and on. None of the antibiotics worked on me, and so we trial and error. The doctors did anti-tuberculosis medication for me. So that is when we figured out, okay, like we think it's actually tuberculosis, it's spine tuberculosis bacteria that developed. So yes, that was 1.5 years almost of tuberculosis medication also post that. But then
Gotcha.
it was fine. After that, everything was fine. I was fine. Like I didn't had pain as such, like in my legs or sciatica pain. Nothing was there. I used to have, on and off pain in my back, but that is what I thought. Like it's because I'm sitting too much or I'm just standing too much. It's because of that. And after 2 3 years, like recently in this January this year, January 24, I thought like, yeah, I'm fine. I should start some gym, etc., and start some activities for me myself.
Gotcha.
And that is when I joined the gym. I did the gym for 2 months approximately. No, it was
Mm-hmm.
1 month only, 1.5 month. And the same pain that I had before surgery, it was same pain almost again now.
Came back.
Earlier it was just in one leg. This time it was in both the legs. And
Okay.
the intensity was different. Like back then I didn't had that much severe pain. This time it was
Mm-hmm.
much more severe pain than that. I was not able to walk for 5 minutes without pain. And let's leave walking also. Standing for 5 minutes was also a pain for me.
Got you.
Yeah, I mean,
And if
so
we go back, Ayushi, like let's say after you did the surgery, you got that infection, then you went on some sort of like medication, antibiotics for 1.5 years.
Correct, yeah.
Okay, and within that 1.5 year, did they give you anything to do as well? Were you ever active and doing some exercise or rehab stuff?
Not precisely as such. They did tell me, like, while I was there in the hospital for a month or so during the hospitalization period, they did tell me some basic stretches to do at that point of time, but nobody
Mm-hmm.
told me to continue it in the longer run as such. Nobody as such guided that this is the something that you have to do it in the longer run.
Got you.
This is, you need to do this to, like, I mean, at least sustain your back or be healthy. Your spine must be healthy, and you should be doing this.
I get you.
Nobody told
And
me as of now as all of these things.
yeah, and in somehow, I suppose just looking at the time perspective, you had like maybe 2.5, 3 years of like basically, I mean, part of it was medication treatment, and then you gone back to your normal life, and you didn't
Yeah.
do much of training or rehab as
Right, right.
much
Agreed. Yeah,
because
yeah.
the back was feeling comfortable. And then January this year, you said, okay, I need to get back to something. And
Correct.
did you had a plan, or how was it when you gone back to the gym? What was the routine was look like for you?
No plan as such. I thought let's just go to the gym. Let's start. I mean, the person who was training in the gym, they basically the gym trainer. I knew that person from before also.
Got
So
you.
before my injury in 2019, I used to go to the same gym, and I used to speak to that same person who used to train me. Same person told me, okay, let's just come. We'll start with very basic exercises.
I got
Uh,
you.
we'll start very minimal for you, but I didn't knew that minimal was also too much for me at that
I
point
got
of
you.
time.
I got you. Yeah, which means in somehow, since you didn't do much of exercise after surgery, I mean, pain was gone, but your body wasn't that conditioned to any type of
Correct.
movement.
Yes. Yeah.
Okay, then you start that, and then you start to get those symptoms. Let's go back through the kind of like what was the exact symptoms? Like, I suppose did you got some sort of similar fear that maybe I herniated my disc again, or what was it
Right,
like?
right. I mean, I understood. I mean, the moment I got the pain in my leg, I understood it is something similar to that only. I
Hmm.
got an MRI done. I mean, so I almost knew the MRI is going to show exactly almost the same that was there 4 5 years back. I mean, it's not going a lot doesn't changes in MRIs, right?
Absolutely.
So I knew it would change, but this time, like, there is a gap that they measure in the spinal column, I guess, right? On the MRI, the AP diameters that they mention. So the diameter was way too less. It was something 6.8
Smaller.
something at the, yeah. So that is what the doctor told me, that do exercises, do some rehab,
Hmm.
and if it doesn't work out after trying rehab exercises, then we'll think about something else. That doesn't work out, we'll try steroid injections, I guess, epidural steroids.
Hmm.
And I knew, like, epidurals don't work. Like, for a lot of people, they don't work, because while I was there in the tuberculosis medication, also they did give me steroid shots back then also, like, just to
Got
sustain
you.
my pain.
I got
So
you.
it used to be there for 2 3 days, and then it's back to the same normal, because when the effect's gone, you have the pain again. So I didn't want to try that out only,
I get you. I get
and I
you.
didn't want to get a surgery also this time done, because I have had experienced the side effects of surgery,
I know. I know.
right?
Unfortunately, I suppose, that's something that is good to highlight for people. Like, we're not against surgery here. I'm just trying to create some sort of education for people watching this video. I mean, as you can mention, one of the side effect that possibly patient can get post surgery is infection. And I've had a couple of patients. Not everybody has it, but I've had a couple of patients that who had infection at post surgery. But okay, then what happened after that, Ayushi?
After that, nothing. Like, I actually tried some local physiotherapists. Okay.
Mm-hmm.
So I went to one physiotherapist. I tried for 1 month. Uh, I don't know what he made me do. So I mean, I was doing almost the same exercises, Bob, that you have told me, but it
Yes,
was mix of each and everything in just 1 hour of instant, right? But
I got
which
you.
I feel like at some point, some exercises work, and at some point, some exercises don't work, right?
I mean,
And
depends on your injury,
correct,
absolutely.
correct. Injury and the condition the patient as is at that moment. So exercises should be framed accordingly. So
100%.
my pain actually increased from a level of 4 5 to 10 while after doing those
After the
exercises
physio.
that the that trainer told me.
I got
So
you.
I quit that for after a month. I didn't do anything.
And did he give you any treatment as well, Ayushi? Or did you got any manual therapy or any treatment as well?
No manual therapy as such, but he was doing some acupressure kind of something which I don't understand what was it. It just felt good for 2-3 minutes. After that, it
I get
was
you.
same again. He did give those IFTT treatment, which is there like initially for 5-10 days.
I
He
get
gave
you.
that just to calm down the pain, but he moved after that. He moved to exercises, and it was a mix of n number of exercises in just 40-50 minutes at once, which was too much, I guess, for the body at that point of time, right?
Probably, yeah.
Yeah.
You're right. And did you
So
do anything at home as well, or it was only when you were going to the physio?
I was going to, I mean, he did tell me to do 4-5 exercises at home also. I was doing that at home also. So
Hmm.
it is those similar exercises that I mean, you have told me, right? To, as a part of mobility exercises, one or two might be different, but almost the same exercises. But right, it's just the way the exercises should be planned out. That
Yeah,
is what I
it
felt.
was not much customized for you. It
Correct,
was probably what I see from your messages that it was maybe a little bit too much for that stage of your rehab.
correct. Yes. For
Okay.
example, if I can tell you, I had symptoms of stenosis, right?
Yes,
I
absolutely.
had problem in bending backwards, right? I am
Yeah,
able to
extension
bend
wasn't.
forwards. You are told me anything to pick up from the ground, I'll be able to easily pick it up. You ask me to bend backwards, I can't. And he
Yeah.
made me do those cobra poses, which
Mm,
should not have I should not have done
yeah,
that. And I didn't knew that at that point of time, which is when I
I got you.
did my own research. I mean, I spoke to you, and then I got to know that okay, this is bad for my health. I should not have done that.
Yeah, so especially when it's sensitive, because this is some of the question that a lot of my patients ask me about spinal stenosis is that like you had a secondary spinal stenosis, which was because of the disc, and it happened after your surgery, much more severe probably, because
Correct,
you may have not had similar symptoms before your surgery, and in that phase, if you do feel sensitive in that movement, and when they look at your MRI scan, if the AP of your kind of like that level is smaller than before, it give us some indication that actually, there could be some pressure happening there if you're doing
correct,
too much extension. We're not demonize extension and say, okay, you shouldn't do any more extension. But if the patient, like, in the initial consultation, like when you test it, when you're not feeling good with that movement and it's kind of like aggravate your symptoms, definitely you don't want to overdoing it. You know what I mean?
agree, yes.
In that way, I would say in that phase you don't need to do it, and then we can maybe introduce it later on into your rehab, if that makes sense.
Yep, yep.
Okay, then what happened after that, Ash?
Then after that, like I went through n number of videos on YouTube, and that is how I found yours.
Hmm.
So I just thought, let's just give it a try. Like, what worse can happen than I will not get better? That is the worst can happen, right?
Yeah, yeah, yeah.
So
Did
I
you
just
did you
thought,
talk
let's
with
just do
anybody
that.
of my patient
No,
before you contacted
I
me?
honestly didn't talk to anybody. I saw a lot of
Gotcha.
your videos and I saw a lot of so many other people's videos as well. But the
Yeah.
only reason I joined yours was there was actually people speaking, I mean, their own testimonials, giving I mean, their own inputs, what happened with them, like how the plan worked out for them. That's the reason
Exactly.
I joined yours.
Exactly.
Yeah.
Okay. And how did you find, I suppose, the initial consultation, Ayushi? Because I think when we discussed the for the first time, you didn't have that much hope in recovery, wasn't it?
I know, yeah.
Mm,
So initially, the first consultation we have had, like you explained me what my MRI report actually told me, what actually the issue is. So I guess you did tell me that there's some degeneration in the discs, right? At
mm-hmm.
that point, and I do have, I mean, the compression is there. That is what I guess you told me. But after that, I mean, I understood like the consultation was, I mean, at least somebody's explaining me all this is happening, right?
Mm-hmm. Mm-hmm.
Nobody explained me that also in the past. I mean, I had to literally pick up words from the MRI report and Google it to understand what it is
Yeah.
actually.
Yeah, and that's the tricky part, I suppose. I mean, you had that, I suppose, in initial consultation, a lot of question and a lot of, I suppose, doubt about MRI scan. And it's tricky because, we're not only relying on MRI scan, but MRI scan is a good indication of giving us some sort of clarity. You know what I mean?
Yeah,
And it's specifically in your case, for example, you had kind of like two level in L4, L5 and L5S1, you had quite a narrowing of the canal, specifically in L5S1, more than L4, L5, which
Yeah.
was kind of 6.8. I remember that millimeter, 0.6 millimeter, and like when you see those numbers, it has to be some meaning for the patient, and it doesn't mean that okay, this happened yesterday or this is a bad thing. It's not about that. We're not trying to freak you out, but we want to create clarity that okay, you have certain things that we have to consider in regards to your rehab, and does this finding associate or correlate with your symptoms that you have right now? You know what I mean? And then we're looking at okay, based on your, I suppose, information that you gave me, what would be your end goal beside pain management? Because initially, obviously, you want to get pain-free and improve your symptoms. Okay, then in regards to initial consultation, did you felt that, okay, for example, you got more information from your consultant and people that you met so far? Because you probably saw after your MRI scan, did you talk with your consultant? I mean, he mentioned about pain management, physio, and I suppose injection or surgery.
Right. No, I did not go to him because honestly, doctors are more focused on giving allopathy medicines and treating it. But one good thing about that doctor was he did tell me that exercises will only cure you. That's what he told me. So
Very
that is
good.
what I heard. And he did tell me that I can give you steroids. You can try that out, but I
Yeah,
will not give you an surety that can help you.
yeah,
But you exercises is what you need to do it in the longer run as well, so you got to do that. And that is why like I reached out to you as well, and then our consultation, we did our consultation, and we then I that is how I took a call that let's just give it a try and do it.
exactly. Yeah. And
Right.
and what was your symptoms, Ayushi? If you highlight them, in that day
Right.
that we
So
discussed.
my symptoms were like I had pain in both my legs, starting from my
Like
back to both the
bilateral.
legs, right?
Yeah.
Yeah, bilateral pain was there. And with bilateral pain, I mean, in one leg, like the left leg, I experienced extreme heaviness. If you want to people understand that, it was
Yeah.
extreme heaviness, and there was burning symptoms in one leg, right?
Hmm.
And it was very difficult. Initially, it was very difficult for me to like lift up my leg also to work like for four,
Yeah.
5 minutes. The day I used to have that pain, it was very difficult for me. And then the other leg, I mean, it was completely different kind of symptom. It was some pain was traveling down my leg, like it was something is pinching me, like some pinch need somebody's putting a needle on my leg. It felt like that
Got you.
pain. And that is how like with slowly time the pain did got better.
Got you.
So
And in
yeah.
regards to activity, before we start your routine, what was your activity would look like? What activity was impacted with your pain or with your injury?
I have a 9 hour shift, like a corporate job, right? I where it's a
Yeah.
sitting job,
Yes.
and it's just saying 9 hours, but I have to honestly sit for more than that also in
Yeah.
few days. But and I was just lying down on my bed and keeping my laptop on my lap, and then that's how I was working, right? Initially,
I get you.
yeah.
And
And
in regards to walking, doing
walking, I was not
homework,
able to do it honestly. Like I did 5 minutes is the maximum I could walk. Like 5 minutes, 500 meters. If I could just
I remember
justify in
that.
that length also. Because
Yeah,
500 meters hardly. Like right now, I'm just able to cover up 5,000, 6,000 steps also, like in the
yeah,
entire day.
yeah. And mentally, I suppose, Avishi, you were pretty kind of like freaked out and even like
I
you
was
can
super
really,
freaked out, Bob, honestly, because the surgery that I had in the past and the repercussions of that surgery that I've experienced, right?
yeah,
That were, I mean, that surgery only gave me so much of setback in my boy in my mind, that
yeah.
I was not ready for it. Like, oh my god, what will happen if this doesn't work out? I will have to again go for a surgery, right?
I
That was
know
my
that's a
initial
fear.
thought, right? That was my
Yeah,
thought because it didn't work out for the first time. Or I mean, I did not connect with the right people at that point of time,
yeah,
possibly that also.
yeah.
So that is was my initial thinking, and I was not ready to go through that surgery phase again.
I know, I know. Nobody wants to do that, definitely. Okay, then in regards to when we start your rehab plan, Avishi, maybe describe for people like in regards to the plan. How did you find the plan? In regards to your own symptoms, and was it like clear for you what you have to do? And maybe you describe that for people.
Right. So, as far as the plan is concerned, like you prescribed, I guess, mobility exercises twice a day, right? And in the mobility exercises specifically, there's one exercise I can't it's a hip 90-90 exercise. Yes,
Yeah.
that helps me, still helps me in the pain that I sometimes have on my hip area right now
Yes.
also. So that does help. Like in the morning when I wake up and I do that, it does helps a lot. Like it helps me to continue in the longer run in the day. So that helped a lot. And more than that, I understand mobility help, but for me, the specifically the rehab exercises that you have planned, uh, that were I mean an entire I mean it did boost my confidence, like okay, I can do this also, I can get up, I can do
Absolutely.
exercises. Because
Yeah.
in my head I was thinking that I have joined gym, I just started working out, and that is why it happened to me. But
Mm,
I when I took over your plan, like I understood, okay, we need to start with less, and with slowly it has to progress, and that is how I should have done it in the past also.
exactly. Yeah, that's a very good point that you mentioned, is that most of my patients associate pain with some sort of damage, which means whenever they get back pain, especially after recurrence of back pain, and they, if they have MRI, they always associate their pain with the MRI picture, and they picture, okay, either I've damaged the disc, or I pinched something more, or is a nerve that got pinched. They have all of this picture, which is kind of like rarely happen in the moment, which means if you
Yeah.
are having a disc bulge that's been there probably for quite a long time, if you have a herniation, that's didn't happen in over the night, when you get the pain, and but you're definitely right that we always associate pain with some sort of, like, tissue damage. But then you realize, okay, I can do things, but not as much as probably I did in the gym initially. And it was not always like whatever you were doing. I mean, in initial phase, it wasn't like zero pain, right? And maybe
Right.
describe to you, how did we progress your plan, Ayushi, like in regards to like your own symptoms.
Right. So we started, I guess, with very less exercises in the rehab plan, with very minimal body weight exercises, and that too, those exercise, the rehab exercises were more concerned with like uh reducing my symptoms or reducing my pain, right? And
Absolutely.
one or two core
Absolutely.
exercises, if I could recall one, and then the other movement exercises, I guess, were there. Like the bridge was there. So
Mm-hmm.
mostly the exercises are related to like improving the health of the core health, and reducing the symptoms.
Absolutely.
With
Initially.
time, yeah, with time we did progress from body weight exercises to resistance exercise, resistant band exercises, right? So
Absolutely.
just increasing the difficulty level slightly more, right? That is how we can challenge the body, I guess.
Exactly. And in regards to the rehab plan, Ayushi, like, I suppose you see the challenges happening, right? Which means you see the progression. Beside that, we track a lot of things like pain,
Right.
or the symptoms, or day-to-day activity, or walking distance, etc. How did you
Right.
find those tracking or those data for yourself?
Right. So that's one thing is that like I never tracked my walking initially, right? The day I was fine, used to walk for 2-3 kilometers also, and I
Yeah,
never tracked that. And the day I was not fine, I didn't move even 100,000 steps as well. I mean, I didn't do that
exactly.
even, right?
Mm-hmm.
So you made ensure, you did tell me that like pain is secondary. You have to be consistent with what you're doing, keeping the pain in limit definitely, but you have to be consistent with what you're doing, and pain and everything will go down with time, right? And
Absolutely. Which means
that's
tracking
how we
things.
track. Yes, we track things, and that is how it helped. Like, might possible that sometimes like a 4,000 steps was too much for me, so we brought it down like to
Mm-hmm. Mm-hmm.
500 or 3,000 steps. So it's mostly trial and error, what I can tell.
Yeah, absolutely. Yeah, because I think, this is very good to highlight here for people, because when we talk about a customized plan, it does not mean that I have a magical plan that I can give it to you, and a box of good exercise that I can show you. And there is no such thing exist. Otherwise, I would have had a set of plan that
Yes.
everybody can use. But we basically try and see what you can do out of your capability and your symptoms, and what feels good, and but there should be a metric there for you to understand, and give you self, I suppose, awareness, and also confidence that actually I can do this. I have a
Right.
threshold, but I can do this. I can do, I don't know, 200 meter of, I suppose, walking, let's say, as a metric. And now, after 6 weeks, I can do 2,000 steps. You know what I mean? Let's
Right.
say. And I think that hugely help your self-confidence as well, that you basically see that I'm progressing. But um, it's not always progress, Ayushi, as you know. There's always challenges in the rehab plan. And this is something that I try to explain to my patient, that the rehab plan is not a straight line that you go up and up and up and up.
Agreed.
And
Agreed. Yes.
and
Yes.
and there are some stages that you do have flare up during the rehab. And maybe tell people a little bit about that. I suppose those days that you don't feel good with the rehab, you know what I mean? And something happened, you've done maybe a little bit too more, or you got, I don't know, some sort of stress from somewhere or something else. Maybe
Hmm.
highlight that, Ayushi.
Right. So for me specifically, it was a mix of extra things that I might have done, which I didn't realize initially that I have done this. But while
Hmm.
we used to be how you used to have consultations every 2 weeks. That is how you made me understand, like, okay, this is what you have done extra. Like, for
Hmm.
example, I may have went out somewhere and I walked for around like 7,000 steps, while I was generally walking 4,000 steps. So those
Yes.
extra 3,000 steps could have triggered my pain, right? Or maybe like if I was sitting too much, like I generally sit for 2 or 3 hours in a day,
Yes.
like in general, if I'm telling, and I sat down for 5 6 hours, so that could have triggered the pain, or it could be a mix of both, like walking, sitting. I mean,
Exactly.
can be anything, right? That I might
Absolutely.
not be doing in general, but that I have exceeded my limit that certain day, and that could have triggered the pain.
100%. Yeah, and that's a very good way to say it. There's a lot of factors that can influence the pain, and it's good to highlight this again for people, because everybody who has back pain are very narrow focus on their MRI scan and their disc or the bulge or
Right.
tissue. There's a lot of things that goes in our consultation that we highlight and we measure them, like such as your stress level. You know what I mean? Like,
Mm.
if you have some sort of work, family, social stress, is something that really we all have, and in somehow that can impact pain. And people, if you don't never ever measure it, you never know how stressed are you. You know what I mean?
Yeah. Yeah, I mean, people don't realize that also, that this is what triggered the pain. But I mean, if we track it, it generally helps us to understand, like, okay, this is what is triggering and
Absolutely.
this is what we need to avoid.
Absolutely. And alongside with these, we kind of like create a customized diet plan as well for you, Ayushi,
Like, yeah.
all through the program. Maybe describe how do you define the diet, and the food, like from the start where we start you, because you were kind of like, I think everybody has a typical diet that they eat, right? If you
Right.
live with your family, you eat always the same food that you cook at home. What was your thoughts about the diet?
Right. So, like a typical Indian family, every Indian household has a bunch of carbs that we eat, right?
Yeah.
And my family still eats that,
No, man,
but
I
with
love those
time,
food. I love
I
those
mean, it
food.
is tasty.
Yeah, yeah.
Wherever the
Amazing.
carb is involved, you get the taste.
Of course, yeah,
Yeah.
absolutely.
Right.
And
So, but
and
yeah, with time, like I mean, you did tell me, okay, Ayushi, you need to increase your protein intake and cut down your carbs, and that is how you will be able to get fit also. So that
absolutely,
is what I have inculcated right now. Like I've cut down my carbs. I mean, not entirely, but at least minimized it, and
absolutely.
increased my protein intake according to my body weight, and that is how, like, I guess we should be doing it in the longer run as well. And
And you can
I
see
guess
some
that's what
changes, I
works,
suppose,
right?
as well,
Right,
overall.
right. I did see, like, I have shed down around 2 3 kgs, and
Amazing.
that's been the greatest part of it.
Absolutely, because I think one of the things that I try to really reemphasize this with people with back pain is that when you have back pain, your total focus is about your back instead of your focus should be on your health, which means this is the saddest story that everybody experiences, because when you have a pain as such as back pain, your total focus is that I need to relieve this pain, and they totally forget about their, okay, am I eating well? Am I sleeping well? Am I too much stress? Am I active, or do I have a good social support to support my or helping, you know
Right.
what I mean? Now, diet is another thing that really impact your health because like if you don't eat the right food, it's not only cause you to gain weight, uh, gaining weight is something that it has its own side effects. But beside that, your energy level, your blood sugar, it's all over the place. Which means if you are going to do things as such as rehab or exercises, you need to have good amount of energy to be able to recover your system, and that food recover your body. And the purpose is not even to just drop down body weight or body fat percentage. The goal is that to recover those muscle and I suppose tissue that who's been working more than
Right.
usual, and that recovery is a huge thing. The second thing is that gaining weight hugely correlate with increasing the pressure in your lumbar spine, which means like high BMI, which
Yeah.
is is a common thing in everywhere in the world, but if you simply think about one factor, high BMI, it's correlates with lower back pain, which means simply you creating more pressure there. Now, if you have a spinal stenosis, yeah, high BMI has a huge correlation with it, which means for people with spinal stenosis, they highly recommend to drop down body weight. But the issue is that most of them, they can't really walk much because that aggravates their symptoms, or they can't stand much because that aggravates their symptoms, and they just give up. They say, okay, I can't do this, Bob. How can I lose weight? You know what I mean?
Right.
Which means the first thing is that you start to watch, okay, how can I improve my health? How can I drop down some body weight? It's not all about exercise, but your diet hugely help. And you can have alternative as such as, stationary bike, you know what I mean? Which
Yeah.
means try something different or get some help, get a customized plan. All right, I can talk about this forever, but
Yeah.
the message that I wanted to really share with people is that focus on health more than focusing on your symptoms. It always helps you to
Yeah.
improve. It's not a quick fix, but it does help you to improve. Okay, now Ayushi, if I fast forward from where we start you, how are you right now in regards to where we start you? I mean, this is 5 months later, right? And I suppose it's been a long way to get you to here. Maybe describe for people where you are right now. How's your symptoms? How are you feeling?
So right now, I am at a much, much, much better place. Uh, I don't have the fear at the moment that okay, this will not get better. Okay, and like I am doing my tasks, daily tasks, whatever I have, I am doing that freely. Some days I do have pain, like very few days I do have pain, but
Got
that
you.
does not stops me from doing my task. I don't even think about it most of the times during the day,
Very
like
good.
that I do have pain, right? And
Amazing.
it has improved drastically. It was a long journey, I could say, but I can't recall what the word is. But you have to be consistent, I guess, and patient enough to get to this point where you recover properly and you get fit properly, right?
Absolutely.
Physically fit and mentally fit both.
100%, 100%. And let's
Yeah.
say symptoms that you have right now or level of
right
pain that you
now
have. Yeah,
right now I don't have as such pain in my, I mean, the symptoms in my leg have completely gone. I don't feel pain in my leg.
amazing.
Very few days, I once in a while I get some pain, very minimal pain in my leg, but that's also, I mean, it can happen because of anything. I don't really focus that much. I do have pain I mean, left in just my one part of my hip area in my left leg. I mean, left
Got you.
side of my hip, and some pain in my lower back. That is
Got
what
you.
is left right now. Apart from that, I don't have any symptoms in my leg. No pain, no burning. Nothing is there.
Amazing. Amazing.
Yeah,
And in regards to progression, Ayushi, like obviously, I mean, we're going to start you to do more weighted exercise from now on, you know what
correct.
I mean?
Yeah.
Which means you're in different phase of your rehab. How do you feel about that?
I am actually excited about that because when I joined the gym in January 2024. So I
Yeah.
actually joined that because I wanted to get lean and I wanted to shed down my body weight. And that
Yes.
was my main aim. So, and I wanted to lift actually weights because
I know.
from the time I had surgery till this time, I actually feared of lifting up weight, picking up
I
anything from
know.
the ground.
I
So I
know.
never did that. So that was the reason for me to join gym and understand, okay, let's just challenge my body and just take this forward. But God has some other plans. But now I'm again excited that this is going in the right direction, and I will be at a much different place in another 3, 4,
No.
5 months, right?
I know, absolutely, absolutely. I'm excited to get you started on that. I mean, you definitely have much more confidence, more strength, you're fitter, you know what I mean, and you have more positive belief about your back. Ayushi, if I ask you to maybe pinpoint, I suppose some tips for people, you know, who watching this video, who may have some similar injuries. If you were going to share with them maybe 3 or 4 tips, okay, that help you the most in regards to your recovery so far, you know, in a very brief way, what would be those 3 or 4 would be?
Okay, so first would be patient enough to not think so much about pain, like, okay, I have pain, what should I do, what should I do? This is what I have done, so that's what I'm telling, that I have stopped doing that right now. So be patient, and be consistent with the exercises, especially the mobility exercises that you prescribe at least twice a day. So do as what you do say them, I mean, depending on the patient's body condition, whatever it is. uh, be consistent enough, and manage your stress levels, and be confident that you can get better at least, right?
Amazing, amazing, amazing. 100%. I think your beliefs hugely impact your recovery.
Yeah,
Seriously, and that can take time to regain your beliefs, isn't it?
I mean,
Because
it took me 5 years, so
I know, but I think, you know, every person, you know, their beliefs is based on their awareness and their understanding about your injury or things that goes around the injury. You know what I mean? That's why I think, you know, getting some help is hugely important to get some clarification, and that clarification can hugely maximize your results. Ayushi, thank you so much for your time. It's been a great, I suppose, journey to work with you. You know, thank you for sticking to the plan and trusting the process. Um, Anything else that you'd like to share with people who are watching this video?
as such, nothing, but whoever is suffering from pain, at least, especially back pain, uh, just do try, give her at least an intro call with Bob. So, I mean, you at least get a clarity of what you have, what issue you have.
You're very
So,
kind.
yeah, so what you will be needing to do it in the future, at least you take a call on that. I mean, one call won't, I mean, do worse for you. I mean, you at least get to know what is gonna be there for you,
I got
right?
you. I got you. Yeah, 100%. I'll be happy to help anybody. I suppose at the end of the day, my mission is to help a million people, 1 million video of recovery. Honestly, that's
Yeah.
my goal, and we're getting there, you know. And I'm delighted to see people recover, and nothing can makes me happier to see my patient recovering with conservative treatment. And I have to say this, that some people may need surgery in some stage, but if you never try the conservative treatment, at least for 6 months, you just jump
Mm.
into something that you don't know. It might have got better by conservative treatment. Do you know what I mean? Which
Yeah.
means what research and study even support is that if you need surgery, in some cases they need urgent care and they need surgery, and we can't do much about it. Now, if you decided to go for surgery, but you do have a choices of okay doing rehab or surgery, what I always recommend my patient is that we're not trying to say okay don't do the surgery, but try at least 6 months of rehab. If that didn't help, then you have a clear head, say I've tried it, at least it didn't work, this is my last option. Is that fair?
Yeah. Yeah.
Actually, thanks
Correct.
again for your time. I appreciate it. We may update your forward, you know, maybe 3 months time, 4 months time, we record again your progress,
Definitely.
because we're starting your, I suppose, home gym exercises with weights now,
Yeah.
and I'm looking forward to that. Thanks again.
Same here, Bob. Thank
Cheers.
you.
Cheers.
Yeah.
I hope you guys find this video helpful. If you have any question regarding your injury, you can leave me comments. Please don't leave me comments to help you without knowing you. Rehab takes time, and for me to be able to help my clients, I need to know them in details, in a personal life, and without knowing those details, I cannot provide you any type of information. However, I do have a lot of free plan or rehab that I will share with you underneath of this video that you can follow by your own. These rehab plans help thousands of people all around the world, and you can try them too. If you need further assistance, you can always book an online consultation with the link below, and I would be more than happy to help you and provide you a customized plan, and we can get you started right away. Before we finish, if you find this video helpful, make sure to subscribe my channel for my weekly update. Press that like button and share this video with your friend and family. Until next week, all the best.